What is your opinion regarding the mass closures of community pharmacies in recent years?
Um, it's bad news, primarily for the general public, the patients. Um, the reason we, the reason why I think it's bad news is if you cast your mind back for to what 3 4 years ago, we had this pandemic, right? And it was utterly impossible to get to see a clinician. So pharmacists were the first port of call for people to come and seek treatment, advice, and help for their ailments. Another time, coronavirus was a thing. People needed to, pick up medication. Even at a point in time, due to supply chain issues, there were shortages and stuff like that. But pharmacies were open all the time. Some GP surgeries weren't, and even till date. When's the last time you tried getting a GP appointment? It's like pulling teeth.
Yeah, I had to wait. I had to wait like 2 months.
Exactly.
Yeah.
Or else you want to see your pharmacist, all you do is stroll in and we'll see you. So the main selling point for us as pharmacists was our accessibility, and that has never changed. So for every community pharmacy that shuts down, that's one less port of call for the general public to seek advice, help, medication, or what have you. So I think it's a bad thing.
How do you see the landscape of community pharmacy changing with the introduction of independent prescribers?
It's not going to change very much. The truth of the matter is that an IP qualification is a useful thing to have. It helps to have another strand to offer the members of the general public, because I did tell you it's all about people in the final analysis. The landscape in terms of people being able to access healthcare either in the form of an advice or in the form of a prescription, or to be able to obtain certain medications due to the fact that the pharmacist happen to be an independent prescriber, is just to enable people to do what they need to do. And if you cannot get an appointment at a GP's, then where do you want to go?
Yeah.
At least you be treating with somebody who knows about the medication, who knows the possible side effects, who's probably got access to your medical records to know your allergies, etc. So it would be an advantage for you and the members of the general public. That's the way I see it. And long may it continue.
And do you see online pharmacies as being the future?
No. They would also be part and parcel of the tune that's playing. But an online pharmacy, there's certain things that they cannot do that a bricks and mortar pharmacy can do. Give you an example. You get people, maybe they are time poor, so they might decide to go to an online pharmacy. I'm not going to bother naming the pharmacy, but there's a very popular one about. Now, here's the thing. We've got, due to, a combination of COVID and from sort of companies going out of business, etc. There are severe supply chain issues for some medications. Okay, give you an example. At some point in time, one very popular set of medications was HRT, hormone replacement therapy. There were shortages. Somebody, a GP might give a prescription for something. It comes to me. I take a look at it. The brand that the GP is prescribed is unavailable. There is another brand available. I'm on the phone to the GP, or I send them an email. I tell them, listen, you've prescribed A. It's off the market. Word on the street says it won't come back for the next 6 weeks. However, there's B available. What are your thoughts? The GP says, okay, go ahead. I'll send out another prescription for B if you can obtain it for the patient. 30 minutes later, patient's got their medication. Job done.
Problem resolved, yeah.
You go to an pharmacy. If the item is out of stock, they return it to the GP. They don't make any suggestions. They don't, and then the GP tries again. So there's a lot of toing and froing. So just by virtue of the fact that we can help sort of negate some of the negativity surrounding supply chain issues, I think bricks and mortar pharmacies will always have a good input into patient healthcare.
I understand. That makes a lot of sense. And you mentioned earlier stock shortages.
Yeah.
How are you coping with some of the stock shortages of certain medications?
Sometimes just by prayer, actually, because to be perfectly honest with you, there's some things that are short and there are no alternatives. Give you an example. We've had a lot of interest whipped up by the media on the class of drugs called GLP-1s. Okay, now GLP-1s basically are the most popular one. Two ones are available are marketed in the United States under the name of Wegovy, but marketed in the UK under the name of Ozempic. Now, what Ozempic does is it's originally an anti-diabetic drug, but it also cuts your appetite in half. So they found out that it actually works to help people lose weight. So all of a sudden, the media whipped up interest. Everybody wants it. Now, the supply chain is geared towards, they use a historical figure to calculate how much you produced this year. So, for example, if I shifted 1,000 units last year, all things being equal, I'm thinking maybe this year I'm going to shift 1,200. But now demand is for 5,000.
Wow.
It takes time to gear the supply chain to produce the to cover the shortfall. So because of that, there are shortages because there's lots of people demanding it. Weight loss people are demanding it. Diabetics are demanding it. So because of that, for those sorts of situations, it's just a case of patience. But for most things, there will always be an alternative. And our business, our knowledge base is to suggest alternatives to what is in short supply, and that we can help. Yeah.
Oh, okay. And this is another question we have. Do you believe that pharmacists are underutilized?
It depends on how I feel when I get home in the evening. So I think I'm very well utilized.
Yeah.
But having said that, I suspect that as time goes on, we're going to be asked to take on more and more roles because the demands that general public have of the NHS are never ending. And as long as their demands continue to expand, our roles are also going to continue to expand. So,
would you recommend a career in pharmacy?
oh yes, I would definitely. Like I said, I've been at it for pretty much a little over a quarter of a century, and there's never been a day I wake up and say I regret doing what I do. No. I like the day-to-day interaction. I like the dynamics of managing a team. I like the way we deal with people, because I'm a people person. I like the way I can apply clinical knowledge to solve people's medical problems. It's a wonderful job. Literally, it's a wonderful job.
That's amazing. And what would you do differently if you could go back to the beginning of your career?
Probably what I might done differently would be to maybe do a bit more in a hospital. Yeah, because like I said, I did a bit in there, but not much. And I would have liked to have maybe 2-3 years in a hospital on my CV rather than the year I have.
And what do you think you would have gained with that additional time?
I might have pursued further qualifications in clinical pharmacy because the NHS, the hospitals tend to encourage that pathway. I didn't, and I've come to realize that is a little gap in my CV I would have liked to have plugged. So maybe, yeah.
Yeah, thank you for that. And what advice would you give to someone pursuing a pharmacy career?
I would say develop, hone, shine, polish your people skills, because that is always the big difference between a so-so pharmacist and a good pharmacist. Listening to people, active listening, engaging with them is vitally important because sometimes it's stuff they don't say that counts. And you know what they also say? The most expensive drug in the world is the one that's not taking. If the person does not trust you, the person does not trust their clinician, their prescriber, they will collect a prescription from you, they will take it home, but they will not swallow the medication, they will not apply the medication, they will not use the medication. You need to gain their trust, and the way to gain their trust is to listen. It might not make sense to you what they are saying, but believe you me, it helps a lot. Give you an example, right? certain men, probably maybe of African origin, they tend to find that certain types of antihypertensives, as medicines for their blood pressure, it has an effect on their potency. They won't tell you. But if you ask the question in a very delicate manner, tiptoe around it a little bit, and they open up to you, you'll find out that's the reason why, no matter how many times they take a prescription from you, their blood pressure is uncontrolled. It's because they are not taking the meds. There's always an alternative, but you need to engage with them to understand where they're coming from and then guide them to where they need to go.
And that's only built through trust and the people skills.
And the people skills, yeah. You would notice a good pharmacist will be somebody who, in a social setting, forget about a clinical setting, but in a social setting, is comfortable. Because they got good people skills.
I understand.
That's where it goes, yeah.
Thank you so much for your time, and we wish you another successful 25 years of pharmacy.
Thank you very much.
MediReach.
Always a pleasure.
Thank you so much.